here's our little cyst here, and there's a little punctum there that we're going to try to remove anyway. It's here. Great, make sure nothing ever hurts. Is this the only cyst you've ever had? Hopefully you'll ever have?
Yeah.
You don't have any other issues. And you said it's years since you've had it? Or it's
I think
it's
I've
actually
had
been
it for a very long time.
Yeah, just slowly kind of grows up.
Yeah.
Huh? They do that.
I just always thought it was a pimple and it was going to go away.
Yeah. Now this one has kind of burst before, and there's a little scar tissue under here, so I am not that convinced.
I can feel that.
You can feel something sharp? I'm so sorry, because it's underneath the skin. Sometimes we go underneath.
Sorry.
Don't worry, I've got numbing here. I got more numbing, okay? Can I have you put this actually? Like that. It's good, it's the end of the day. I got squirted by you. That's why I wear a mask with a big shield on it. I'm gonna actually try to, because it's going to not come out in one piece anyway, so hold on, I'm gonna give a little squeeze here, see if that'll make it come out more. And allow us to still take it out of a smaller hole. Can you do a little bit squeezing here? Just block, don't this is super hard because it might squirt too fast. But no, not so much. There you go, something there. Push down a little bit on it, maybe that'll help it too. So that's what we got here. An incision here. You're fine. I'm not making anything wide. I'm just trying to get to the cyst sac there. I actually might release it more. I'll push against you a little bit. To make it a little bit wider. Right now it's very narrow actually. We didn't make it big at all, so just making it a little wider is not going to be a big deal. I'm sure you just want it off first of all.
Yeah.
Get it all out. There's a cyst wall here. That's what we want to tease out right there. Thank you. Mm-hmm. Great. You can feel me pulling, but you shouldn't feel anything sharp. Uncomfortable. You're doing great. See, you can hear that sound. It's because there's a little bit of scarring there. You're okay though, as long as you don't feel anything. You know, I'm just kind of trying to take off the little sac wall without it teasing it all away here. See some more still on this lower edge here. That looks pretty clean now. See this, just trim this side here a little bit where your scar is. Just trim this because looks pretty good from this angle here. I see nothing in there. Let me see this side here. see anything there. All right, I think I got it all. I'm just gonna take my little Q-tip here now and just double check this whole area. So there's a little bit of cyst maybe, but that looks like scar tissue. That's it right there. Looks pretty now. Yeah. See where it was taking up space? It was kind of taking up space right in this whole area here. Okay, let's put a couple stitches in and you're good. Let me just trim the edges. What I have to do is make sure the edges are very nice and flat so that the scar line heals nice and flat. In the back, we all have thicker skin than areas like on our face, for example, so we need to make sure that wound edges are nice and flat and not wider on the bottom than on the top. We'll just make sure we clean that whole edge. Let's see if it closes okay here. See, it's a little wider on the bottom, so let me actually trim it a little bit more. Otherwise, it won't lay properly. Just can't grab it well. There we go. You're gonna hear a buzzing noise just so I can see if I can buzz the edges a little bit to keep it nice and contoured here to my liking. Okay, let's try that. Okay, suture. I'm gonna put suture in here that, probably gonna put a kind of suture that you can take out even in 12 days. We're happy to see you too. Actually 14 days. I'm gonna probably put in something that you're gonna be able to wait longer. I might put a different suture in that other smaller one that you'll take out sooner. I'll give you directions though, because that one only needs one suture and a more delicate suture. So, got tangled here. Let me see what's going on here. Okay. So I'm putting the suture in here. Is thicker, we're trying to evert the wound edges, turning them out, but still pulling it together well. And sometimes it's hard, but then you have thicker skin at the back, so take a bigger bite and try to pull those edges together as well as we can here. So quiet here today. Because it's the end of the day. Let's see, it's nice and flat though. It is not. The cyst is not there anymore. You just have a little scar tissue there, so it's going to be firmer. I'm going to change what I'm doing here. I'm actually going to make sure I see you. Oh, let me see. I'm going to try to. No, I can suck you and she's moving a little longer. I'm going to have you easy use that. Thank you. doing like a lot more cysts. I'm learning about them actually. I used to avoid these because they're messy and I get squirted like I just got, and they're just like a pain sometimes because they're hard to get out. It was a little bit of a challenge, but you know, now they're kind of fun. Now I kind of am learning. I kind of can predict. You know, I kind of knew this was going to be harder to do just because of her history that she gives me, and it's like it's proving right. That's good. Thank you.
Mm-hmm.
My girls here too are happy when they get a chance to squeeze.
Mm-hmm.
Make sure that's good and laying flush here. Gonna make that tighter to make sure that stays as flush as we can.
You know, actually, Dr. Lee, I think I feel more pressure filming now.
You do now?
Yeah.
Oh, really?
I'm like, oh, I gotta get a good angle
yeah,
for
I know.
everybody.
Well, because I'm very, you know, I'm demanding.
And I'm just like, oh, this lighting is not good.
Yeah, I think of all those things now. My
patients
patients probably go, come on, now, just settle down and just do what you got to do. But we want to make everybody happy. Can I do a 5-0 look? I'm going to put a 5-0 look right there. Do you live close by?
Yeah.
If you don't mind grabbing that, and I'll just put that right on.
Okay.
I'll do that.